Thank you for having me today. And the title of my presentation is Eat Well and Move More, a Path to Maximize Health and Well-Being. I've always wanted a career in epidemiology and specifically in nutrition and physical activity because, a lot of the diseases that result from lack of physical activity or poor nutrition have affected my family. So my dad passed away when he was 55 years old. He had very bad uncontrolled diabetes, and he likely passed away suddenly from heart complications due to the diabetes. And growing up, my grandma also had diabetes, and she was not able to control her blood sugar very well. And she had to take care of 12 grandkids, including myself. So she didn't have a lot of time or a lot of money. So that's always really had a very big impression on me about her struggles with health, and that really motivated me to pursue a career in this area. So a lot of this is probably not new information for you. A lot of different organizations have dietary recommendations, and they all kind of follow the same pattern. Things like eating lots of fruits and vegetables. So eating 4.5 cups per day, having 2 or more servings of fish per week, trying to, replace your refined grains with whole grains. So eating 3 or more servings of whole grains per day, eating nuts, including things like peanut butter, legumes and beans and seeds, as well as getting movement every week. So, the optimal goal is to get 2.5 hours of physical activity per week, but any activity is really important. And these recommendations also have certain things that we should avoid. So try to reduce your sodium intake to less than 1,500 milligrams per day. And I'll talk a little bit about ways to do that a little bit later on in the presentation. But also not drinking a lot of pop. So having less than 3 cans of pop per week. And processed meat. So, a lot of folks eat processed meat, things like hot dogs, Vienna sausages, banquet chickens, Spam. So trying to limit that to 2 servings or less per week. And of course, avoiding sweets that are high in saturated fat. So, some of people need a visual representation. They prefer that. So this is an example of my native plate. So the recommendations follow similar guidelines to what I just showed you. It's just a visual representation. So this is a 9-inch plate. And the goal of my native plate is to fill half of your plate with vegetables, and the other half with proteins and grains, have fruit on the side, and also drink water. So drink water in place of those sugary drinks and pop. And also to stay active. So again, try to get as much physical activity as you can. So as part of the Strong Heart study, we evaluated, how folks are doing with their diet and with their physical activity. So some of you participated in the Strong Heart family study, which in the first exam of that, which was way back now in 2001, you were asked to fill out a food frequency questionnaire. And, it may have felt annoying at the time. Sometimes these questionnaires are long. There were questions about 110 or more different foods and how often you eat them and, what the portion size is. But that information has really helped us understand how folks are eating and, what they're doing well with and what we need to do have some improvements on. So from that data, we were able to determine, are people meeting these dietary guidelines? And it seems like folks are not meeting the dietary guidelines, for most of these, both healthy and unhealthy foods. But it's not just a problem in the Strong Heart study, it's an American problem. So this graph is showing who achieved these goals, and the Strong Heart study participants are shown in red, and then the general population, that's including everyone, so not just American Indians, that's shown in green. So, here in the United States, we have a long way to go to get folks on the road to eating healthy, to maximize their health. And also in that exam, the Strong Heart Family Study back in 2001, you may have remembered you were given a pedometer to wear for a week, and you were asked to record the number of steps that you accumulated each day in a diary, and then mail the diary back to the Strong Heart Study investigators. And from that, we were able to tell how many steps per day people were taking. And the number of steps per day is really a marker of physical activity. It doesn't get at things like swimming or bicycling, because it's really only capturing actual steps you're taking. But you know, most people do walk for exercise, or you know, even just day to day chasing kids around the house, you know, cooking, going back and forth to work. So for most people, walking is a major form of activity. So what we found was that folks in Strong Heart took an average of about 4,900 steps per day. So current recommendations recommend between 8,000 and 10,000 steps per day. You know, improving physical activity, you know, in the community, and getting people to walk more is also a goal that we have. So what do we know about eating well and moving more to maximize health? So we've done several different types of analyses with the data from the food frequency questionnaires and from the physical activity assessment. And I'm just going to highlight a couple of the major findings. So what we found was that, you know, processed meat was consumed pretty regularly in the communities. About 70% of people reported that they consumed at least 2 or more servings of processed meat per week. And the folks who ate the most processed meat were twice as likely to develop diabetes than the folks who never ate any processed meat. So there were about 15% of people who never reported eating processed meat, and they were much less likely to get diabetes. So here's just a visual representation of that. We also know that eating processed meat at least 2 or more times a week is associated with more rapid cellular aging. So in that, we know this from the study of telomeres. So essentially what happens is, you know, we age biologically, and a lot of people think of aging, they think of like maybe getting gray hair, getting wrinkles, your bones may start to ache a little bit, you lose muscle mass, you know, your bones might get frail. But your cells are also aging, and what happens is there's chromosomes at the end of cells called telomeres, and they shorten over time. So as you age, they shorten. And what we found was that folks who eat processed meat at least 2 times per week have more rapid cellular aging, so their telomeres get shorter, which again is associated with all kinds of health issues, including heart disease and diabetes. On the other hand, we found that folks who consume the healthiest diet, so folks who consume the most fruits and vegetables, and you know, who consumed lean meats and you know, grains and things like peanut butter, and less of things like pop and sodium, they had lower total cholesterol and LDL cholesterol than folks who didn't eat healthy. And what was interesting was that the effects were most pronounced in people who had diabetes. And that's kind of important because, you know, sometimes people get, you know, they get diagnosed with diabetes, and you know, they might give up. They're like, well, you know, I already have diabetes, you know, so I'm not going to worry about you know, eating healthy anymore because, you know, I already have this disease. But what we found was that in people who have diabetes, those who ate the best, you know, who ate these fruits and vegetables and lean meats, the effect of their diet on their cholesterol levels was better than folks who do not have diabetes. So that's just saying that, you know, even if you have diabetes, you know, what you eat is important, and it's not just important to control your blood sugar. It's important, you know, to maximize your overall heart health, to lower your cholesterol. Okay, so for physical activity, an interesting finding that we found was that, you know, folks are taking about 4,900 steps per day, but even small amounts of activity, so increasing, you know, your activity by 3,500 steps was associated with a 30% lower risk of developing diabetes. So, you know, if you look in the literature, if you look on the internet, you know, a lot of times you see these numbers thrown around, you know, take 10,000 steps per day. You know, to maximize your health, take 10,000 steps. And that can be discouraging to a lot of people because if you're inactive, you know, getting up to that 10,000 steps is a lot. But what we found is, like, you don't have to be a marathon runner. Even small amounts of physical activity, just movement in general, really has health benefits. So if you can't get up to that 10,000 steps, don't just, give up, sit on the couch. Just try to do small things. Any activity is important and it improves your health. And, I grew up in a really rural community, a very cold community where there's snow essentially from October to May sometimes. So I know that there are challenges in rural communities to eating healthy and into exercising. So some of those challenges are things like the limited availability of healthy options at local stores. And that, at least where I grew up, that was really a problem in the wintertime. Where getting fresh produce, the quality of the produce that was available in the winter was not very good, since it had to come on a truck all the way up to Canada. And I'm sure some of your communities have similar issues. Also, long travel distances to stores. Sometimes local stores, corner stores, don't have healthy options, and you might not have a car, you might not have a driver's license. So getting, to stores to buy food can be a problem for some people. Also, food costs. Some healthy foods are expensive. So, if you have a limited income, eating healthy, the cost of food could be a barrier for some people. Weather, as I said, I grew up in Canada, so I'm very familiar with how weather makes it hard to be physically active in the winter. Some of you, I'm sure in Dakotas, are familiar with that, while some of you in Arizona have the opposite problem where it's too hot, probably to go outside and go for walks. And another thing is time. Like, we all live really busy lives. We have family obligations, we have work obligations. So, sometimes, eating healthy or, going for a walk or being active takes a back seat to other, life events. I have 2 young kids, so I totally get it. Sometimes I have the best intentions to go on a walk, and then, the baby starts fussing, and you just can't do those things. So, all these things are barriers that are part of our everyday lives that, we have to think about when we're talking about eating healthy and staying active, because it's not easy. But it's not an all or nothing thing as well. So just small changes matter. So, you might get discouraged when you go to the grocery store and they don't have, lots of different options of fruits and vegetables, or lots of different options of whole grains. But even just pick one, just like one small change will really help you. So, if there's brown rice at your store, pick that instead of the white rice. If you're thinking about foods for you or your kids to have for breakfast, instead of choosing, the frozen waffles, which my son absolutely loves, but, instead of choosing that, choose, a whole grain cereal, Cheerios, or, All Bran. Choose oatmeal instead of cream of wheat. Oatmeal is a whole grain, cream of wheat is a refined grain. If they have it at your store, choose whole grain pasta instead of just the plain white pasta. For snacking, popcorn, that's an excellent whole grain, and it's pretty low in calories as long as you don't saturate it in butter. So choose that instead of potato chips. So just small changes matter. It's not all or nothing.